We're going to go ahead and move on and have Yugoji, and I'm sorry if I'm butchering anybody's names today, with the role of safety professional.
I've unmuted myself. Hi, Mara. I think you tried.
Thank you.
I think you tried in terms of pronouncing.
Right, without butchering.
Okay, so good afternoon, everyone. I'm happy to be here. Today I'll be speaking on Stop the Pandemic, the role of the safety professional. So I'd like to share my slides so that we'd have talking points and you'll be able to see what I would be talking about. You're welcome to my session. Because I just have 30 minutes, I'm going to try to run through as fast as possible. I'm not sure if there is an opportunity for questions and all that, but by the end of this session, we'll all be able to have a little bit more information on the various ways we can act. Indeed. So who am I? My name is Ugochi Obidiegu. I'm the managing partner of Ulomka. Ulomka is a health and safety social enterprise based in Nigeria. We try to reduce avoidable accidents by creating products and programs to bridge the safety education gap rather, with our children, parents, and educators. So a lot of people know me on social media as the safety chick because of my work in raising safety consciousness. I'm the author of a child safety storybook series, The Adventures of Muna. Okay, yeah, that's behind me. Okay, so there are 43 books in the series. And we recently released a really small booklet on the coronavirus for children. I'm the convener of the School Safety Summit. So every year we'll bring educators together, then we'll bring safety professionals to share knowledge so that these educators know how to create safe spaces in their schools. Also, I'm the lead trainer of the Train Them Young initiative, which is our own way of giving back to the community by visiting schools, teaching children in schools, book clubs, summer camps, how to act in different safety situations, because I'm sure you would agree with me that the best time to teach people about safety is when they are growing, so it becomes a part of them, all right? Then very recently, I created the Safety Cheat Compass. It's a safety education app, which is a one-stop hub for blog articles, podcasts, books, videos that teaches safety in a simple way to parents and educators. And yeah, I am a TEDx speaker. So I just had to do that brief run through about who I am so that you would understand maybe the angle I'll be coming from and why it's important for us safety professionals to see how we can make an impact, not just in our workplaces, but taking it out there to the community, to social media and the like. All right, so introduction, like Mr. Eddie said, we already know about COVID-19, we know the symptoms, we know all that. So it's been here for a while, many people have died, but again, a lot of countries have risen to the task. They've done their effort to curtail the spread as much as possible. So the thing now is, many people are beginning to think that since things are sort of controlled, we need to begin to think of how to go back to work. But before we go back to work, we need to ask ourselves, how can we ensure that the progress we have gotten so far is maintained? We do not want a situation where things relapse, and then we all, it becomes a disruption once more. All right, so what has been the ripple effect of the COVID-19 so far? Illness, death, business disruptions, school closure, except for maybe a few schools that are having online activities, but school closure. Then there's restricted movement because everyone has to be home for quarantine. And then of course there is fear and anxiety, which by extension leads to mental health issues. Then there's also the case of violence. When people are cooped together in a space, at some point they just, tempers are rising, and people just want to take it out on someone. And then there, of course, there's loss of jobs and income. I would like to talk about the informal sector a little bit. Now, these ones are not really in a structured space, and they've been highly hit. So most times in developing countries, they're at the point where they have to make a choice between health and hunger. And like someone said on the news recently in Nigeria, he said, I would rather die from coronavirus than the hunger virus. So that tells me that if the guy has a situation comes up and he needs to go and hustle, to make money, he will not find the fact that coronavirus is in town. Do you see? So by extension, this puts him at risk, his family, the community, and then, it's just a ripple effect. So as safety professionals, you are important. The world actually needs us to help in stopping the pandemic. So it's not enough for it to be handled to a point, and then when work resumes, we go back to status quo. No, we have to play our part. So according to the ILO report, in the face of a pandemic, ensuring safety and health at work, workplaces are effective platforms where employers and workers together can disseminate information and sensitize on occupational safety and health, including for prevention and protection measures to reduce the spread of infectious diseases. So that tells you you are important, whether you are a safety professional in an organization, or you run a health and safety business, or you consult for different organizations. This is the time to make use of that position, because like they always say, charity begins at home. All right, so now we've experienced the COVID-19 for a while. Did you live up to your role as the safety professional? So what do I mean? Did you provide proper updates on COVID-19 to your staff? I mean, this has been around for a while. Did you do that? Did you also try to share this information to your customers? Because the truth is, they may not know so much as you, but as long as they interface with your organization, you have a duty towards them. So did you share information with them? Again, when remote working started, did you also share information with your staff on how to create a safe workstation at home? Bearing in mind that for many people, this is the first time in their lives that they are working in this kind of conditions. Some people have been doing remote work prior to now, but for so many people, this is the first time they've had to deliver on goals, but within the confines of their homes. So did you inform them on the things to do? Did you also share information with them on how to act when they have to go out to shop for essential needs? Then again, at the moment, we're talking about returning to work. Have you also started teaching them that, okay, when work resumes, things won't be as usual. This is how you are expected to act. So do you see, at this point, people look to safety professionals for leadership. Even if you work within an organization, the CEO is expecting to hear your point of view from the safety angle. So if you're not providing it, then it's a problem. So you need to provide leadership. So you need to ask yourself, did you lead? And well, it's never too late. If you haven't been leading, you can start today. Going forward, things can change. All right, so I've put together different roles we can perform, and I didn't just want to streamline it to just the safety aspect of things. I tried to make it well-rounded, because in as much as you're the safety professional in a workplace, the people that you are in charge of, the employees, they have other things they might be experiencing in different areas. So I'll be taking you through various roles and then letting you know how you can get involved. So the first one is create an emergency preparedness plan. So I'm sure a lot of people will say, oh yes, we have an emergency preparedness plan. But when this pandemic started, did you notice some loopholes in your preparedness plan? Did you see that some things worked well and some things did not even fly? So this is actually the time to reassess your existing emergency preparedness plan and begin to ask yourself, so where are the loopholes? Then you plug it. Now, if you can see that the whole thing doesn't even work, this is the time to create new ones. Because trust me, it might seem like, okay, we're working towards ending this pandemic, but other things can happen in future. And you've got to be prepared, because you just never know. Okay, so plug loopholes. Again, according to the Occupational Safety and Health Convention number 155, Article 16, employers have the duty to ensure that workplaces, machinery, equipment, and processes under their control are safe and without risk to health. So basically, that's it. You need to create an emergency preparedness plan, first thing. Now, what's your next role? Your next role is you need to integrate emergency preparedness plan into the occupational safety and health management system. So we already know what the management system is, right? It ensures integration of key elements, policy, organizing, planning and implementation, evaluation and action for improvement. Now, it's important that this system that you have created must be communicated to all relevant stakeholders, internal and external. So based on what you noticed during the emergency preparedness plan, you would have also noticed where your management system did not work quite right this period. So this is the time to manage all those things before people physically resume at work. Then it's important to make provision for first aid and medical assistance and provision of training. So you need to gauge what are the training needs for the new system you'll be putting up, and how are you going to communicate these things to your staff or employees, as the case may be. The next role is prepare the workplace for resumption. So a thorough risk assessment has to be done of the entire work environment and even your processes. So what are the key areas you need to bear in mind? So we know that the major communication this period has been social distancing. So we need to ask ourselves, so if we're going to do social distancing in the workplace, how are we going to do it between worker and co-worker? How are we going to do it between worker and customer? So you need to make plans for social distancing. We're also aware about the droplets being on surfaces and how people can pick them up from touching commonly used surfaces. So you need to have a plan for cleaning. How often will cleaning be done, and what areas will be mandatory? The next one is personal hygiene. So you know how it is now in the workplace, we have all types of people. We have the clean, and then we have the not so clean, right? So we need to see how can we encourage personal hygiene, and then for people to keep improving their levels of personal hygiene, because somebody might think their personal hygiene is great, but maybe that personal hygiene is on level 1 and we really want it to grow to 2 to 3 to 4 to 5. So you need to have plans for that. Again, training needs and how it will be communicated. Then this is the time to talk about PPE. At some point months ago, we had a shortage of PPE worldwide, but now many people are creating more PPEs to ensure that that is not even a challenge. So you need to ask yourself, how are we going to provide this PPE? Then how will it be disposed? Because most times we all think of getting the PPEs and then we're not talking about disposal. And we should bear in mind that if not properly disposed, it could cause another problem. So we need to be careful about this. And then we need to have plans for how to respond when a case is identified at work. Now, when you make all these preparations for resumption and you communicate it to your staff would feel more comfortable to resume work. So for example, here in Nigeria, the president made a statement yesterday that things are going to be relaxed a little from next week, and some types of work will start. Now, I know people who are worried about sending their children to school when school resumes. So of course, people will be worried about resuming work. But if as a safety professional, you've prepared your workplace and then you've communicated to them, it boosts their confidence that they're going to be protected within that space, okay? So the next role again, okay, yes, still under preparing the workplace for resumption. For those that are safety professionals in essential services, you need to ensure that your risk assessment suits the different types of workers in essential services. So what you're going to have for the medical personnel will be different from the those who handle human remains. The key things to consider, because these are the people that are at the front line, is reduce direct access to clients and customers, provide PPE, rearrange the work process and system. Then please, by all means, try to factor in sick leave and hazard pay, because these people are at risk really. For the informal workers, they may not have good structure like this, but again, as safety professionals, this is why we must team up in our various associations, even with our organizations, and say, okay, how can we help the informal sector? Could it be that we do more sensitization so that they understand what is at stake? Could it be that we provide them with free PPE, or we provide them with palliatives, food, resources, so they do not need to go and work to end their daily living, as it were, okay? All right, so the next one is plan to manage mental stress. So I know you're going to say, oh, you're not a psychiatrist. Oh, I'm not a psychologist. I'm not a mental health doctor. That's understandable. But again, as safety professionals, we've got to show leadership. There is huge uncertainty across the world. People are worried about losing money, losing jobs. People are going into depression. Essential workers are fatigued. Some people are not even motivated to make plans for the future. So you've got to show leadership. Think of mental health resources that are available and try to connect your staff to them. You do not have to be the one running the mental health practice, but just go online. There are lots of people that are offering these services for free, and some are offering it at a subsidized cost, just to ensure that everyone is carried along. So look for the one that fits into your organization's budget, right? And then provide information to your staff that, okay, if you have so and so problem, this is the helpline to call. You can send an email or you can send a text message, but just get that information and share to your people. It's also important for you to begin to share beneficial mental well-being tips. So by this, I mean, You could write an article, an email, a newsletter, create a video or a social media post where you're teaching people how to manage stress. And of course, you can just Google and learn. So you could share how exercising is great, having routines, journaling, eating right. These things actually help with managing mental stress, you know? So you could actually get this information and share. Also, again, this is the time as a professional to liaise with HR and see how workload can be reviewed this period. We're not working in exact conditions, so things need to be reviewed. It's also important to mention that you also need to consider home realities. So imagine a mom or a single dad who has children in the house and he's not going to work, his caregivers or living help are not around, school is not in session, he has to juggle work, taking care of these children, and online schooling. So you see that there's a lot going on there. So you need to help them manage these things by reviewing workload and making things easy for them by sharing helpful tips. Again, if you have staff with special needs, you must consider them. Look at the peculiarities of the situation and create systems that will suit them. At the end of the COVID era, people are going to remember how their organizations made them feel, how individuals treated them. And you want to be that person or that organization that your staff would remember fondly, that you were there for them. And so one of the things you can also do is try to infuse group humor and relaxing activities to what staff do. So I'm aware that there is a law firm here in Lagos, Nigeria, who actually conducts movie days on Friday with their staff, just so that people can have something else, in a relaxing atmosphere. And then after watching the movies, they just discuss, chat with one another. That helps. So just think about your particular context and see what are the things you can begin to bring in, what can you begin to suggest to management to manage mental stress of employees. The next one is help to reduce the risk of violence. This is really important because people are cooped in spaces, they just want to react, and then there's limited movement, there's limited essential needs, so people just want to flare up, transfer their anger somewhere. So it's really important that you are educating you're educating your staff, your employees, that this is how to manage yourself when you feel this kind of way. And again, you don't have to be the expert. You can collaborate. Look around on social media. Who do you know that can speak to this? Invite them to come and have a Zoom session with your staff. And that can be really helpful. Another thing you can do is, for those working in essential services, create safety systems and work processes that reduce the direct interaction between customers and employees. Then for employees with abusive partners, connect them with right resources. So I know that you might have staff who do not want to tell you all about their business. They don't want to tell you if they're being beaten at home or what trauma they are going through. Your own job is collate resources. Send an email, send a newsletter. If you find yourself in so and so situation, use this. If you find yourself in so and so situation, use that. That is all. They will just interface with the material you have sent to them, and that gives them some anonymity. So for example, here in Lagos, we have the Domestic Sexual and Violence Response Team, DSVRT. They created a campaign about it, sharing information and helplines. So if, for example, you're in Lagos, Nigeria, you can just share that resource with your people. And your people can make use of it if they find themselves in that situation or they know someone who is in that situation. And of course, create safety communication in different formats. So whether it's catchy videos, nice pictures, posters, emails, newsletter, just use what suits your unique context. But the goal is help to reduce the risk of violence. Now, the next one is teach them about ergonomic workstations. So you can see this workstation on the screen. It looks beautiful, right? But it is not going to suit everybody. And like I mentioned at the beginning, I mentioned that for some people, this is the very first time they're going to be working from home for long periods. So you need to teach them how to set up an ergonomic workstation that would not lead to ill health down the line. So some factors to consider when you're teaching them is teach them how to choose the right furniture in their homes. And I'm smiling because I remember that last week, some schools in Nigeria started their e-learning system. And I saw lots of children using their parents' workstation or sitting at the dining table. And this will not totally suit their size. So I mentioned that you not particularly have to buy a new furniture if you cannot afford it, but there are ways to improvise. If, for example, it's a low table, see how to add books put books on the table and then put your laptop so that your laptop is elevated. As simple as that. So teach them about choice of furniture, teach about lighting. You do not want a situation where somebody now has eye issues just because they've just been working strictly on a device. So teach them how to adjust lighting, to reduce glare, brightness, stuff like that. It's also important to teach them about how to arrange tasks and work tools within reach so that they are not over twisting, bending, overreaching, and all that. Teach them how to create these things, and then breaks. So I've been going online to survey the reports people have been putting in about their lockdown situation. And people are saying that they're actually working more now than when we didn't have this situation. This tells me that people are not able to separate their life, time to work and then time to relax and face home activities. So we have a role to play by teaching them to ensure breaks. Do you see? So teach them about these things because it all comes together. The next part is get involved in coordinated information sharing. So the WHO and the ILO have been putting out information on the various things to do to protect yourself, the various strategies for organizations to take, and all that. So it's really important that we play our own part to get this information from the right sources and disseminate. Use your social media for good. I'm sure you're all aware of the infodemic that happened this period. Lots of wrong information was being spread across WhatsApp platforms. It was causing so much fear. We, as safety professionals, we have to rise up to the challenge of speaking about these things, sharing information in a way that others can understand, creating content that aligns. So for example, what did I do? Because I'm a children book author, a safety storybook author, I had to create a safety story booklet, the picture on the screen for children, just something small to teach them about the coronavirus and how they can stay safe. And I made sure it's available in English and French. We had physical copies. Over 1,000 was distributed across 6 states here in Nigeria. But then we also made sure that the e-copies are available on the website so that regardless of your location, you can download it and your children can learn. Because we found out that some adults do not still believe that this is real. And if they do not understand, they are transferring that to their children. So we need to ensure that the children know so that they also are able to protect themselves. Okay? Then the next one is get involved in social dialogue and collaboration. So we can't live isolated, right? We need to know what is being said at international levels, what is being said at government levels, what is being said at sector levels and at industry levels, so that we're able to take that information, weigh it as safety professionals and see, does this work? If this is not working, how can I make my voice heard? Provide our own valuable insights to these organizations so that the right information would be put out there, so that the right safety protocol will be created. So again, I'll use an example. Here in Lagos, Nigeria, yesterday, the governor of Lagos State mandated that as of yesterday, anyone who has to be seen in public must be wearing masks. Now, I'm sure that he didn't just wake up and make that decision. He had to have meetings with different bodies and asking, so what do we do? If we're really saying that at some point we need to relax measures, we want people to go out, how can we ensure that this does not lead to a bigger problem? And so information was shared. So it's important that we contribute our voices to what is being said, plans that are being made. And then when these plans are made, we have a role to ensure that our organization complies. So for some of us, we know the reality. Maybe, for example, we are safety professionals in factories, and we know that the numbers that are in factories can be too much, will not give room for social distancing. So this is the time to now make all the plans and then communicate to your organization and to your workers that this is what we need to do to ensure that people do not fall sick. And I think that's really important that when we're telling people what to do, we shouldn't just tell them what. We need to tell them why, how it impacts them in real terms so that they understand. All right. Okay, I've already mentioned that we use that information to implement engineering and administrative controls. Okay, so how am I doing for time, Meryl?
I was waiting for an opportunity to interrupt you. We have 10 more minutes. And
Okay.
while I'm speaking with you, everyone is inquiring to see if they can get a copy of the slides sent over to them.
Okay, yes. I've made the slides in such a way that I can share it. So
okay.
Maybe I'll communicate with Mr. Eddie about how the slides will get out.
Yeah, maybe add slides. You can forward it to add slides, maybe, or
Yeah.
one way or the other to have it available for everyone
Yes,
to
it's going
have
to
it.
be available. Yeah,
Okay.
so I'm wrapping up. This is actually my last slide.
Okay.
So
All
as
right.
safety professionals, we are an important component in keeping the world safe. From our homes to the workplaces, to the communities, to social media, states, countries, and the world at large. So we need to rise up to the challenge. We've got to show leadership and play our role well. So that's the end of my presentation. And I'd like to invite you all to the Annual School Safety Summit we organized. It's going to be holding 16th May in about 2 weeks' time. Feel free to invite parents and educators so they can also gain knowledge. It's going to hold online. As long as you register on schoolsafetysummit.net, you would get an email with details of whether it's going to happen on Zoom or on YouTube, but whatever the case, regardless of your location, you'd be able to be a part of it. So thank you all so much for paying attention to me. That brings me to the end of my beats in celebration of World Day for Health and Safety at Work.
Thank you.
Thank you.
Thank you for joining us.
You're welcome.
Do we have any, can we have questions right now, Eddie, since we still have time?
Yeah, we can. We can have questions.
I have question.
Go ahead.
Yeah, my name is James.
Okay.
Yeah, I really appreciate the first facilitators. She really talked about the necessary things to do as a safety person. But my question is this: as a safety professional person, what are the major roles and the risk involved in this period of lockdown? And what are the necessary mitigation in place to get this thing done?
So, James, to your question,
Yes.
do you mean in the workplace or do you mean generally in the general
No.
environment? Or are you switching to the workplace?
Actually, considering what is going on now in the world, considering what is going on in the world.
Okay, so there's a whole lot, there's a body of information on that out there, right? So as safety professionals, I think I even mentioned some of it within this slide when I made my presentation.
Right.
We're already aware of the problem. Our job is to create a solution that suits our unique context. Whenever I have to speak with my coaching clients or organize trainings, I always mention that you cannot just do copy and paste when you are doing safety. You've got to take your unique context. So for example, now we've mentioned general things that you need to do, but then you need to bring it into context in the particular workplace that you're working in. So say for example, you're a safety professional in, what example could you use now? In a school. Yes, you're a safety professional in a school. The safety systems you're going to put in place for resumption of physical school activities might differ slightly to someone that is a safety professional, say in a factory, in a bakery, in the oil and gas sector. Principles would remain standard, but you must ensure that your control measures suit your unique context. Because again, like we all know, what you're going to put in place in a bungalow will be totally different from what you're going to put in a skyscraper, because they have different realities. But if you listen to this, the presentation I gave earlier, you'll be able to pick out some points that you can begin to implement in your workplace. Thank you so much for your question, James.
Thank you very much. Thank you.